We suggest you pause this video often. It helps to study the slides.
We are next going to discuss female fertility in the context of the menstrual cycle. By understanding her menstrual cycle, a woman knows when she is infertile and when she is fertile. Married women who understand their cycles are capable of planning their families naturally without recourse to artificial hormone drugs or devices such as condoms and IUDs. Natural family planning is in full harmony with the Catholic Church's teachings. But first, a few disclaimers. We will not attempt to teach you a natural family planning method in this course. I am a trained NFP teacher and am familiar with many of the NFP methods. However, the Fertility Awareness 101 course is designed to give you basic training by assisting you in learning how the woman's reproductive system works. When you are ready to learn NFP, we suggest you select a teacher trained in the fertility awareness-based method of your choice. Secondly, we will be discussing the natural secretions of the female body. Words like moist and wet can sometimes seem to denote something unhealthy or unclean. I want to assure you that they are not. We will be using proper terms for body parts and using adjectives that describe the sensations that these secretions make when they leave the body. There is nothing unnatural about the feeling of wetness, so there is no need to feel embarrassed. Before we begin, I want you to relax, because there's no way that you can remember all of what we will say and cover in the first time that you hear this. But you can always come back to this reference. And there are many other good references you can consult as well. Our objective in this course is to encourage you to learn your own reproductive system, because if you do learn it, you can own your fertility. Ownership means your body and its fertility belong to you. You are responsible and in possession of it. If you don't learn it, you might feel tremendous pressure to rely on something outside of yourself, namely synthetic steroid hormone pills or implants. These synthetic steroids are harmful to both your physical and spiritual health. The naturally cycling female is a healthy female, and menstruation is part of that equation. Menstruation usually begins between ages 12 and 15, but can start as early as age 8. Menstruation stops at menopause, which occurs around the age of 50. How long is the menstrual cycle? Well, the healthy menstrual cycles can range from 21 to 36 days in adult women. We will refer to a 28-day cycle in our discussion. 28 days is probably the median average menstrual cycle, with 50% of women being 28 days or longer, and 50% of women being 28 days or shorter. It is also important to note that counting days is more like the old rhythm method, which can only be depended on by women who are completely regular. While we will be speaking about modern fertility awareness in this video, we will use cycle day numbers to help clarify the information. But do not be concerned if your cycle doesn't match exactly with our numbers. Each woman is unique. That is why it is necessary for you to learn what is normal for you. In this segment, we will be discussing the phases of the menstrual cycle. The terminology of menstrual cycle stages can be confusing. Some refer to 4 phases of the menstrual cycle: menstruation phase, follicular phase, fertile phase including ovulation, and the luteal phase. We refer to only 2 phases, the follicular phase and the luteal phase. However, we will break the follicular phase down into 3 stages: the menses stage, a stage between menses and the ovulatory stage, and the ovulatory stage. We will again refer to an average 28-day cycle to explain. The follicular phase begins with the first day of menses and ends 1 day after ovulation. The menses stage is the first stage of the follicular phase, approximately 5 days in the 28-day cycle. The menses stage is usually an infertile time. A woman should feel wet with the bleed. The second stage of the follicular phase is between the end of menses and the beginning of the ovulatory stage. This is a stage of infertile time. approximately 4 to 6 days in the average 14-day follicular phase. A woman will feel dry or low levels of moisture at the vulva, and the feeling remains the same each day. The ovulatory stage is the third stage of the follicular phase. This is the fertile time of approximately 5 to 7 days in the 14-day follicular phase, ending 1 day after ovulation. A woman will feel changing levels of wetness and finally a slippery sensation around the time of ovulation. She may also see clear, stringy, stretchy, lubricative mucus in her underwear or after wiping. The luteal phase begins immediately after the follicular phase. The luteal phase begins 1 day after ovulation and ends on the first day of menses or bleeding of the next cycle. In a 28-day cycle, the follicular and luteal phases are about equal in length, approximately 14 days. During the follicular phase, the woman is fertile only some of the time. During the luteal phase, she is not fertile. Remember, these time frames are averages. Each woman and each cycle can be variable, so it is essential that every individual woman discover what is normal for her.